In this short video, we're going to look at the anatomy that is shared between both male and females, starting with the perineum. Notice this does not say peritoneum, it is perineum. The perineum is considered a very private place. This is usually the area that's known between genitals and anus. This area is outlined by the pubic arches and the coccyx, and then the bony landmarks of the inner edges of the pubic outlet, as you can see in this picture. It basically forms a triangular or diamond-shaped area, extending literally from anterior to posterior sides of the patient. This would be the area you'd be looking at if a patient were up in stirrups, both male and female, and you were looking directly down from where their feet would normally be. The perineum is divided into two triangles, an anterior and a posterior triangle. The posterior triangle is also known as the anal triangle. This is because it contains 1/3 of the anal canal, the anal sphincter muscles, and the ischioanal fossae. So essentially, it's the area that houses the anus and the muscles around it. The anterior portion is known as the urogenital triangle. This is because it contains the opening of the urethra and vagina in females and the root of the penis in males. If we look at the viscera of the pelvis, this is the internal landmarks. We know that each patient is going to have a bladder, rectum, and then internal reproductive organs. We'll look at the reproductive organs separately, but we're going to look at the bladder and rectum cohesively. So the bladder is a pyramid-shaped muscle organ that rests on the pelvic floor. It is posterior to the pubic symphysis, and it functions as a temporary reservoir for storage of urine. It takes about 200 to 250 milliliters of urine to fill up before you're sensing an urge to have to go to the restroom. When it's empty, the bladder has 4 sides. The superior side is the body of the bladder covered by the peritoneum that allows loops of ileum and sigmoid to rest on it. The posterior side is the fundus or the base of the bladder. It sits near vaginal wall or rectum wall in males. And then there's 2 inferior lateral surfaces, and they are in contact with the levator ani muscles. The neck of the bladder is a convergence of the posterior and the inferior lateral surfaces, and the inferior angle is the funnel-shaped narrowing. There is posterior lateral angles. This is where 2 ureters enter the bladder, and the apex of the bladder is a convergence of the superior and inferior lateral surfaces. I know that seems like a lot, so let's look at a couple pictures. This might help you make more sense. So essentially, the bladder is a 3D triangle where I have an inferior lateral border, and directly on this other side over here is another inferior lateral border. And then we have a superior border, and then the posterior border is this fundus or base that we're seeing here. Here is that apex of the bladder where superior and inferior form. The neck of the bladder is this location where urethra joins it, and that is on the borders of where the 2 inferior lateral borders meet. The bladder is anchored by ligaments, basically 3 different locations. The apex is attached by a median umbilical ligament. The body is attached by 2 medial umbilical ligaments. These are the remnants of 2 umbilical arteries. And the neck is attached by the puboprostatic ligament in males and the pubovesical ligament in females. I'm going to go back to my cartoon pictures. Okay, we're not showing much of those ligaments in this picture except the one that is here. That is, the apex is anchored by the median umbilical. And then we have 2 ligaments essentially that extend, not these are ureters, that will extend off of the sides of this inferior lateral bladder. Let me go to another picture. So this picture is less of a triangular shape of the bladder, but it gives us a sense of ligaments. This would be apex, so we would have median ligament here. Here are our umbilical ligaments. These would be running essentially right along those surfaces where superior and inferior borders meet. So those ligaments would extend basically along here and come out this direction, which is what we're seeing in this picture right here. And then the neck of the bladder I mentioned was attached by either puboprostatic or pubovesical. That would be these ligaments right here. The neck, remember, extends down here into urethra, so we typically have a couple of ligaments that are named differently based on the gender of the anatomy that we're looking at. The bladder is often referred to as a trigone because it has basically 3 walls or 3 openings in the floor of the bladder that form a triangular area. 2 openings are created for ureters to drain urine down from kidneys, and then 1 opening is the entrance to the urethra, the tube that takes the urine out of the body. So this forms the trigone. Here's a coronal image so you can see it in a real patient. This big thing that you're seeing here is bladder. Notice it's lopsided. We don't have a perfect bladder, and depending on how much fluid is in there, the size of the bladder can change. So this one, I know it looks lopsided. It probably is. It's just because the patient's bladder isn't super full. And so we're seeing bladder, the neck of the bladder would be right here, which would extend down through here if we're a little bit more far forward. So in this picture, we're kind of near rectum, which means we're a little bit on that posterior portion of the bladder there. Here's the bladder in a couple axial pictures. So it's a big rectangular shaped object. We can see it in both images. Notice it does sit right behind rectus abdominis. That should make sense if you've done a pelvic ultrasound or even pushed down below your belly button when you have to go to the bathroom. You get the sensation that you're going to pee. That's because that bladder sits relatively superficial in our body. Notice the structures behind it. So in a female, we have to have basically uterus behind it and then rectum. In a male, we're going to have just bladder, and then we are going to have rectum almost directly behind the bladder. Both genders have a urethra, a muscular tube that drains urine from the bladder. Both genders have that urethra pass through a urogenital diaphragm, which contains the urethral sphincters and is responsible for voluntary closure of the bladder. The female has a short urethra, only 3 to 4 centimeters, where a male urethra is much longer, 18 to 20 centimeters. This should make sense based on anatomy. The male urethra has to extend not only from bladder, but through the length of a penis, and so it's going to be 3 to 4 times longer than what a female. This also helps explain why females tend to have more UTIs than males, because bacteria can travel back up through that urethra much more easily in females than it can males. The male urethra is subdivided into 3 parts because it has a longer part. There is the prostatic urethra that passes through the prostate, then a membranous urethra, which is a short, narrow portion of the urethra that goes through that urogenital diaphragm, and then the penile urethra, which is the longest portion, and it extends from external urethral sphincter to the tip of the penis. As you can see in this picture, it's a little exaggerated, but the cartoon does a good job of showing. So prostatic urethra. This essentially would be this little tiny piece right where my circle is would be the membranous urethra, and then all of this would be penile urethra. The last little part of this is the rectum. It is the terminal portion of the large intestine. It is approximately 15 centimeters long and follows the anterior-posterior curve of the sacrum and the coccyx. It then turns inferiorly and anteriorly and becomes the anal canal, sometimes known as the perineal flexure. Between the 2 flexures is a fold which serves as a landmark for a rectal exam. These are called Kohlrausch's folds. If I show you a picture of that, here is Kohlrausch's folds. This is basically when somebody has an anal exam, if you've had hemorrhoids or probably even just childbirth for those of you that have children, or if you're an older male and have had your prostate checked, they often will do an anal check, and basically when they are extending up in your rectum, they're feeling for this fold, which I know looks really high up there, but it's really not that far. It's like 2 or 3 centimeters inside past that anal canal. And the last little part is just to show you this on a scan. As you go back and look through some scans, you'll probably start to recognize rectum. The biggest indicator is there's often air, so there's often black kind of blotches in the rectum. And that makes sense because we always are going to have some sort of air and gas in our GI tract. That's the nature of what we have. We have specific bacteria in our colon that's meant to cause gas forming bubbles, if you will. And so we're always going to have some air inside that rectum area. What we do want to look for is that it's going to be between coccyx and pubic symphysis. Notice we're pretty far down because we have this is greater trochanter that's fitting inside the acetabulum. So basically we have hip bones in this picture. Notice iliac crest is gone. We don't see any other really landmarks that look familiar to us except for maybe a little tiny bit of rectus abdominis here. This is hiney, so we get gluteus maximus in this picture. I did come back up a few pictures just to show you rectum in this picture. In the male picture, we have contrast in the rectum. So this patient has drank some oral contrast, and so we're getting this white area that's showing up. Again, we're really far down because these are hip bones and we have a big bladder, and then the structure directly behind it is going to be rectum. In females, we're going to have more of a snowman, so we're going to have bladder, uterus, then rectum. So we're going to have 3 structures that are going to be always in a line there.